I'll probably get the virus at some stage, so what am I going to do with the family? I work as a GP at under doctor surgery. I also do Indigenous medicine in Mount Isa with Gidgee healing.
We got that big box of milk today.
Whoa! So Alex is on night duty tonight. He's going to go save the world for us as well.
On standby tonight to go and fly rescue helicopters for South East Queensland.
From the get-go, government said GPs are on the front line, and yep, put my hand up. That's what I signed up for. I have no problems saying that now is my time, but just give us the equipment we need to do it. So we have not got enough PPE, protective gear, and I think the biggest thing that we want, I guess, people to understand is we really want to see you. We're not going to leave anyone in the lurch. We really want to do our job, but we really want to do our job with protective gear. And at the moment, we haven't really been given anything. We haven't been given any resources. So the N95 masks, which are these, are the ones we need, and we were given four forever. We have at least six doctors at work here, and we do this clinic every day, and we were given 4 masks. So that's why a lot of GPs will just say, can't do it. It's just too high risk for myself, my family, and the other patients. Really want to help out, but we really also want to have the protective gear on that we need to have. Probably before all the panic buying of toilet paper and hoarding of food, we were conscious really early on that we need masks. Everything got sold out really quickly, and so people just sort of went to their own devices. I know some doctors that also do things like pottery, so they have access to their pottery masks, and hardware stores. That's where we got ours from. And we just had to get in there quick before someone else got there. Bunnings have become experts in not only paint, but also in terms of what masks are appropriate for doctors. They actually now are really good at helping us work out what masks we need to buy and what we can keep on for a long period of time. Yeah, it's a matter of first in, first dressed. As a doctor in a private clinic, I am getting a lot of my information, I'm sorry to say, but from Facebook. GPs have a forum that we go on, and we try to make sense of all the differing guidelines that are coming out. Each state has had its own guidelines. We've been getting different messages from the primary health networks, and so we all try to come together and go, what are you guys doing? We're just trying to follow the leads, but the lead's changing all the time. Last week we were able to test quite a lot of people, but this week we've run out of kits. There's a couple of people that I've sent to get tested, and 2 of them were turned away that I think probably did have it.
Are you exhausted?
I am so tired, and I think I'm mentally tired because I've got just so many reasons to feel anxious. So I'm bringing my mum here because I can't, if the school's closed, I still have to work. So I've got to bring my mum here, but then I'm putting her in grave danger because I'm doing these clinics. And then my husband works in a really high risk environment. And then to top it all off, I'm going to Mount Isa on Sunday for 2 weeks to be away from my family, and I'm so stressed. So yeah, I think I'm just emotionally a bit tired actually. No matter what I fear or my husband fears, most important thing is that we don't project that fear onto the kids. They're 5 and 7, they don't need to know the reality or anything like that. My duty as a parent is just to make them feel safe. When my mum gets here, we might end up having some more difficult conversations, and even though my daughter's only 7, she's already picked up on the fact that, okay, so you've told me that I won't get that sick if I get it, but what about Alma? I've talked about it to Mum in a lot of detail, and she's just decided that we need her and she just really wants to be here, so we'll try our best to keep her safe. I can't use up my brain on as to, you know, me dying right now. It's just all about the here and now. I truly believe that it's my duty. You know, we're being called out to the front, and I'm willing to go out there, but I've got to do it in a way that I don't fall apart. I get confused as to what I need to worry about at what particular time. Like yesterday, I wasn't meant to work yesterday, but I went to work yesterday because this needed extra people. But then at the same time, I'm like, well, this is the day I pick my kids up from school. This is the day I get to be the mum. So that went out the window. If you could make a vaccine, that would be great. That'd be really handy. It will come, and that will change everything. That will settle everything down. In the meantime, we just have to look at what's worked in other pandemics, and time again we see that social distancing works.